I'm Darren Morton,
I'm Simon Matthews. This is Lift.
the Lifestyle Medicine podcast where we dive into the science of health and well-being.
Well, hello, Dr. Morton. Nice to see you again.
Very good to see you, Simon. And I understand you've just returned from back in your former part of the world.
I have just returned from my homeland, and I'm now back in my home.
Makes
yes.
perfect sense. Yeah.
I just spent a week, actually more than a week, nearly 2 weeks, over on the west coast of Australia, catching up with family and celebrating a 1-year-old granddaughter birthday, which was an absolute delight. So
Very nice.
we all had a lovely time together
Very nice
before
indeed.
we made the trek back across here to Madrid. Yeah, wonderful. So Darren, I've got a question for you.
All right.
It's actually, I want you to tell me a story. I want you to tell me about a decision that you've made in your life that you look back on now and you regret. You regret that decision. It doesn't have to be something major. I mean, I'm not talking about getting married or anything like that. Just might be something.
Yeah, that would not be a good thing to declare. That was one of the best. Sarah, tune into this. This is the best decision I made in my life. So thanks for that prompting there, Simon. All right.
You can pay me later.
Do you know what? I'd answer that probably in a strange way. And I would say that I think the decisions that I've made that I've most regretted are things that I haven't acted on. So it's been like, at a fairly benign level, it's been something like, I really feel like I should go for a run, or I should go do this particular thing. And instead I somehow get suckered into sitting at home, and then there's something that captures my attention on YouTube or whatever. And then later I go, why did I just do that? So I think I've had moments where, and I think about even when I was younger, I was probably a little shyer. I mean, because I'm super reserved now, of course, but no, when I was younger, I was probably quite shy, and I think that there were times where I wish I had have stepped up, and I didn't. And I think that the disappointing aspect of that is I don't ever get to know what actually could have happened if I had done that. So I'd say my decisions that I regret are the things that I didn't try for, didn't chase.
Okay.
Particularly when I was younger.
So there's a name for that, which I'll tell you in a moment. But I'm going to preface this by saying that I think one of the things that you and I probably have in common is that we don't characteristically spend a lot of time regretting. I think you and I are people who just happen to move through life tending to look forwards, not looking backwards. Yes. Nevertheless, the experience of regret is real. And is available to anyone who might like to experience it. And the regret that you're describing is called outcome regret. And it's one of three types of decision regret. And what you're describing to me is an experience of having gone through some sort of reflection and decision making process, and then being at a point where the outcome that you chose is one that from time to time you might experience regret with. So there is a whole science of regret. And that science of regret sits within another body of work around decision making and by extension health behaviour change. And I'd love for us to explore this together today.
So now, before we go on, I want to know your regret. Do you have any key decision that you made or didn't make that you regret?
Oh, good question. I'm just turning my light back on here, as you can see. Any regret? I find it really hard to I do find it very hard to call to mind things that I regret. Um, rightly or wrongly, I think my characteristic approach to life is one of, well, the die is cast.
Yes.
It's
Yeah.
I now have what I have, so
Mm.
I'm going to start at that point and move
Yeah.
forward, rather than kind of ruminate about what could have been or what might have been. And in saying that, I don't want to diminish the very real experience of regret that people can have, particularly in healthcare, and particularly in healthcare choices. So you and I have in a previous episode, we've talked about my favourite behaviour change theory, which
Mm.
is commonly called the busyness theory of behaviour change, or the habit discontinuity hypothesis. And the reason I really like that particular theory is because it's kind of unexpected. It suggests that the best time to make a behavioural change is when you're already really busy doing other things. And that runs a
Mm.
little bit counterintuitive for us, because we think we should clear our plates completely before we try something big. Well, turns out I have another favourite theory of decision making and behavioural change, and it's called multi-attribute utility theory. Now, if I had an opportunity to go back and do a different undergrad program, what do you reckon I would do? I did French first, and
Yeah.
then I did psychology, and I don't regret doing those. Let me say, I
Yeah.
enjoyed doing those. But if I could go back and do something else, what do you reckon I would do?
You know what? I cannot see you as anything other than a psychologist, to be honest. I actually think
Well,
psychology is a good fit for you. The French part, yeah, I'm not sure about the French, although, you've got that swagger about you, but yeah.
apologies to all our French-speaking listeners.
There we go. Well, it's a compliment. That's a compliment, isn't it?
If I could go back and do a different undergrad, I would study economics,
Mm.
because the economics that I've studied in the last few years has told me so much and taught me so much about behavioural change in healthcare, and I've learned to appreciate the nuances of behavioural change in healthcare, as well as the really fundamentals of behavioural change through economics and a number of economic theories. So one of the most basic economic theories is utility theory. Utility theory says we make decisions about things based on a perceived benefit. For example, if you have a choice of 3 jobs, one of them will pay you 6 times what the other 2 will pay. Utility theory says, well, if money is important to you, you will probably make the decision to take the better paying job. On the other hand, if closeness to home is important to you, you'll probably choose that job, and so on. So utility theory is pretty straightforward, and it helps us to understand health behaviour change. One of the adaptations of utility theory is called multi-attribute utility theory. And this is a more complex version that says we will make decisions based on a number of factors. So that might be the salary you get, the prestige in the job, how close it is to home, and maybe the opportunities for advancement you get from that particular job. So multi-attribute utility theory says you'll be sort of juggling and shifting all of those things in your mind to come out with an overall best option for you that's made up of all of those factors. A further development, or maybe extension, or maybe a sidearm of multi-attribute utility theory is called regret theory, which was first articulated about 40-ish years ago. And regret theory really is the emotional response to decisions, or it describes the emotional response to decisions. In other words, regret theory says that we can tend to anticipate regret and make decisions that will minimize or avoid that experience of regret. Turns out that this is a really important part of healthcare decision making as well. And particularly in lifestyle medicine, where a lot of our work is focused on conversations with patients and clients about their healthcare and making choices about what they do with respect to their healthcare. So you described an experience that we would call outcome regret. And outcome, I'm going to explain the three types of regret using a car analogy. So outcome regret is where you make a choice about something. So, for example, you see a car that you like, it looks fantastic. You put your money down on the table. Turns out that if you had dug a little deeper, you would have uncovered some underlying mechanical issues that only emerged down the track. And so down the track, you might regret that outcome because you're now experiencing something that you didn't anticipate. That's the first type of regret. The second type is process regret, and process regret is a bit like it's a bit like rushing the decision to buy a car without doing all the research and maybe going for test drives and so on. So you might end up with a car that works reasonably well, but there's a party that thinks, I wish I'd looked around a bit more. I wish I'd dug a little deeper. I wish I'd been aware of some of these other options, and I wonder whether I would have made a different decision if I'd had that other information at the time. The third type of regret is called option regret. Option regret's when you go out and you buy a two-seater sports car, bring it home, and then a few days later you realise that mostly what you need a car for is to drive your family of four around and do the supermarket trips and things like that. Your sports car works perfectly fine. It's a great car. It does exactly what it was advertised to do. It's just not a good fit for you and your lifestyle and your needs. So 3 different types of regret that can tell us a lot about what we ought to be doing in clinical encounters with patients when it comes to decisions about healthcare.
Let me ask, what first reflection is you as an economist. I don't quite get that. I don't see that. There's actually, I don't know if this is inappropriate
Not
to
an
share.
economist.
Not an economist with no, please don't take offense if there's any economists listening to this, but there's a standard joke that's used apparently in the economy world, and that is the joke begins with what do accountants use for contraception, and the answer is their personality. But then the second layer to that is that economists are those who don't have the personality to be an accountant. So, so Simon, take this as a compliment.
Our previously stellar podcast ratings are now
no accountants or economists are going anywhere near this. But so anyway, I can't see you as an accountant, but actually as an economist. But that whole economy of making decisions based on what's the cost benefit, and I see that. Yeah, actually, I think that certainly that connects with me in terms of from a behaviour change perspective. One thing I'm really interested as you've been describing this is that I think, and all of us probably in listening to what you've said, we can all see ourselves in this. Like when we're making that decision about we're umming and ahhing. And I think all of those 3 things are probably going on to a great extent. It's interesting you used a car analogy because my wife's car engine has blown up, and I'm hoping to get it returned for a very big sum of money at the end of this week. But and in my head, maybe this is what I should have led with when you asked me what I regretted. I didn't do due diligence on finding out that particular model and make of car actually has an issue. But you did say, and I agree with this, is that I find myself, I'm a very sort of future-focused individual. I actually don't tend to dwell too much in the past at all. And I think, and I don't think that's necessarily a good thing. I think that there's probably more value in me actually sort of spending a bit more time back there and reflecting on the journey, that I am very, very future-focused. And I wonder, do you think that for someone who is a bit future focused, is that regret, that decision regret, does that feature less for them, or maybe more for them? I'm
Yeah,
interested in
it's
how
a good.
personality
Yeah,
type might come into this.
yeah. It's a good question. And the very short answer is
Lift is supported by the Lift Project, an educational adventure where you learn science-based ways to lift your mood and your life. The Lift Project is lifting lives around the globe, in healthcare settings, workplaces, schools, universities and communities. To find out more, visit theliftproject.global.
I have no idea.
Yeah. Or is it
yeah.
Is it in an explanatory style thing? Like, because there are certainly decisions that I wish, or things that have happened in my past that I wish hadn't have happened. But then how do I interpret that? Like, I even think about, like, I mean, I run a small business, and some of the things we chased or went after just were a complete flop. And I thought, oh, that was a huge waste of time. But in my mind, I'm pivoting and I'm thinking, oh yeah, but I learned X, Y, and Z from that. And
Yeah.
so
Yeah.
I wonder if there's a little bit of that where it's regrets is reframed. I suppose there's a reframing of regret.
That's exactly the word that I would choose there. That what you're describing is a process of reframing, and I think that reframing is absolutely available to us without being Pollyanna-ish about it. We don't have to reframe every single negative outcome in our lives, and nor should we. But I think there are some outcomes that lend themselves to that, and the idea of learning from failure is a pretty common reframe. We can stand there at the feet of failure and say, well, that was a waste of money and a waste of my time and effort and so on. Or we can ask ourselves, what have I learned from this? And the really important part is not just, what have I conceptually or cognitively learned, but how can I apply that learning now for what I do next? And almost by definition, that then stops that experience being a waste of time. I mean, it's just not possible to say, I got something really valuable from this and it was a complete waste of time. Those two things just can't coexist.
Yeah.
So I think reframing, I think, is for some of us it's probably a little bit explained by personality style. I think it is a skill that can be taught and learnt, to reframe negatives and to look for opportunities, and then to apply the learnings as we move forward. But I'm not sure whether we can say anything characteristically beyond that about regret and personality. Yeah.
A question for you. It would almost seem to me that the potentially bigger problem or more debilitating problem could be fear of decision or regret. So this is where you have to make a decision, but like you say, you've got all those variables. And I see people, with some people are very, very good at just making a decision, actioning that, and then what will be. Whereas others, it's like, but I actually, this sounds really terrible. I feel like I love accountants. I just want to put that out there before I make this next statement, right? But
you've made your bed, buddy.
my really good friend, it was one of my groomsmen, is an accountant, so I have very close acquaintance with accountants. But I remember one time he was about to purchase a motorcycle, and he created a spreadsheet. You're not going to believe that, are you? But he actually created a spreadsheet with all the pros and cons. So and obviously this is feeding into this insatiable need that some of us have to avoid decision regret, if at all possible.
Well, this is a really interesting idea, and I think the fear of regretting something, it's probably a variation of FOMO, fear of missing out. It's kind of a specific application of that. I don't want to make a decision that then cuts off some other options to me. And just as an aside, in therapy and coaching, I have a particular way of helping my clients manage that sort of dilemma, because people often create that as a dilemma of opposites. You know, it's a this or that dilemma. Either I decide this or I decide that, and now I feel stuck, because if I choose that, I miss all these things. If I choose that, I miss all those things. So what I often do in that situation is invite the person to create a third option for themselves, which is deciding not to decide now. And the importance of that is that not deciding then stops being the space that you occupy when you don't choose this or don't choose that. Not deciding itself becomes a decision. I've decided not to make a decision. And so that means that the person starts to, reconnect with their capacity to make a decision about something, even if that decision for the moment is postponing a bigger decision. So, Darren, just as an aside, one of the ways that I manage that in therapy and coaching is by talking with my clients about having a third option there, because one of the hallmarks of that sort of fear of regret or fear of missing out, if you like, is that the people feel stuck in a binary choice. Either I've got to choose that and get some small benefit and miss all these things, or I choose this, get a little benefit and miss all those things. So they feel really caught. So what I do is invite people to introduce a third option, which is deciding not to decide right now. And the significance of that is that it takes that experience of I can't decide and a feeling of powerlessness and helplessness and turns that into an active decision. I'm not just caught in this place where I can't choose this or that. I'm positively choosing not to make a decision about this right now. Once that decision has been made, then you can have conversations about what other information might be useful here and so on, and you can continue the conversation. But that's a useful means of helping to bridge that gap. And in fact, this I guess also sheds some light on lifestyle medicine applications of this and things that we can do in clinical encounters. So one of the important aspects, I think, of regret and in fact minimizing the likelihood of regret or even avoiding the likelihood of regret is to be clear about what informed choice means. Now, we often hear discourse and narrative about informed consent. For example, if you walk into a department store or a supermarket and there's a sign on the front door that says, by walking into this store, you acknowledge that you may be, filmed and so on. That's informed consent. It's simply telling you that this is going to happen, and therefore, if you walk in, you're saying, well, I'm consenting to that. Your option is to turn around and not walk in the store if you don't want to. And there's, I guess, some element of choice there, but it's a very limited choice. It's kind of a forced choice, if you like, come in and be filmed or don't if you don't want to. In healthcare decision-making, the idea of informed choice, I think, is much more valuable. And informed choice requires a detailed conversation with a patient. And it requires that detailed conversation to, first of all, understand what are the needs that that patient has, what are the things that they want to be able to do in their life that will help them to make this particular decision right now. I can give you a good example of this from my own experience. Actually, when I had, I had retinal surgery a few years ago for detached retinas, and then I had lens replacement surgery. And at the time I had my lenses replaced, I could choose between having a lens of fixed focal length for infinity or a lens of fixed focal length for kind of reading distance. And I had an extensive conversation with the ophthalmologist about the benefits and disadvantages of each. And for my lifestyle, which is fairly active and outdoors, I chose the fixed focal length of infinity because I'm going to be spending far more time using my eyes for that than I am for doing something here. And when I need to do something here, I can just pop on a pair of glasses easily. If I had to put on a pair of glasses every time I wanted to drive a car or ride a bike or go bushwalking or whatever, that would have driven me up the wall. So that's a good example of informed choice. I made the decision based on my understanding of my own needs, values, what's important to me, and so on. So this is a really important part of clinical decision making with patients. What matters to you here? What do you want your life to look like? What do you want to be able to do after this particular treatment or intervention? Because that is going to help us to make a good decision about what to do in the present time. And that, of course, really, in many ways, probably loads most strongly on the process regret that we talked about, so that a patient doesn't eventually get a treatment outcome and then think, oh, I wish I'd been able to explore the options more, or I wish I had more information about what was available at the time, or something like that.
So tell me then, what would you? Oh, sorry.
Yeah, no, go ahead.
So I suppose the question that jumps out for me is, as a psychologist who can fix all of our problems, what would you say, like for someone who is dealing with decision regret, what's probably a good way forward? And B, for those people who are really immobilized by decision fatigue, what would be your top tips and advice there?
Well, I'm going to say the best way to manage decision regret is not to have it emerge in the first place. And I think that there are a bunch of things that we can do in lifestyle medicine, clinical encounters, to really minimise quite significantly the likelihood that someone will experience that. And they're those discussions around informed choice, making use of the therapeutic alliance. You and I have talked about this before, the centrality of the therapeutic alliance, clinicians being warm, interested, empathetic, engaged, listening deeply, understanding, curious, and so on. And all of those factors really drive those discussions that help a clinician to understand the patient's needs, and then to have a discussion with them about what the available options are, what the possible side effects or adverse outcomes might be, what can be done to manage those, and so on. Interestingly, what the literature tells us is that when those processes are honoured, in other words, when the therapeutic alliance is really used to its maximum, and when patients have an experience of a good decision-making process, even if they experience some regret, it's typically much less significant than if that factor hadn't been there to start with. And they're much more likely to be able to kind of say in their minds, well, I made the decision I did based on all this information. I've kind of been unlucky, but that's okay. I can still move forward.
Oh, that makes sense to me. I'm even thinking, and the example I used earlier with my wife's car, the regret I have about that was that I didn't do due diligence. I didn't do the research to find out, and the truth is it may have been an outstanding car that can still have mechanical problems, but I think in my mind, I would be thinking, oh, well, that was unlucky, and as compared to, oh, I should have known about that. I should have taken a deeper dive. So yeah, that makes a lot of sense to me, that being as informed as you can, but then at some point, obviously, making a decision and then standing by that and being prepared to live with it.
Yeah, exactly. And again, what the literature about decision regret tells us is that the stronger that therapeutic alliance is, the lower the likelihood of decision regret, um, and the more likely that that regret will be able to be reframed for the person. Actually, I'll give you another example, which is an extension of the first example I gave you. When I had the lens replacement therapy, the ophthalmologist told me ahead of time, there's always a chance in lens replacement that you get some scar tissue forming, just around where the lens fits. And he said that the treatment for that is very, very straightforward. It's simply lasered off, and one of the possible outcomes of that laser treatment is that there can still be little bits of that scar tissue remaining that are almost impossible to remove, except by evacuating the eyeball. Then he went on to say, in someone who hasn't had a retinal detachment, evacuating the eyeball I'd be much more likely to consider, but because you have had, I don't want to disturb what's already going really well. And by that stage, I was 3 or 4 years post-op from my retinal surgery, and things were going and continue to go spectacularly well. So essentially what he was saying was, if this happens, I'll do this treatment. There's a small chance that this treatment may not completely resolve the issue, and I would be reluctant to do anything else unless this is having a dramatic impact on your lifestyle. Well, guess what? I did get the scar tissue forming. I did have the laser treatment. Most of that scar tissue disappeared. There is still a little bit there, and the effect of that is that every so often lights flare for me, so I just get a bit of a flare in my eyeball. But I regret nothing, because I'm very, very happy with the process of decision-making that occurred. On balance, I would much rather now leave the inside of my eyeball alone, even though that procedure could resolve this completely. I know in the back of my mind it could have an adverse outcome that I don't want to experience. So essentially, there's no regret for me. It's not a perfect outcome, but I'm okay with it.
Yeah, because you felt like due diligence had been followed.
Yeah.
I like the way you say I like the way you so casually talk about evacuating your eyeball.
I'll tell you that story another time. I still have memories of the experience because I was sedated rather than anaesthetized. So we learned some really valuable things about clinical decision making and patient engagement by considering these economic theories of utility and regret avoidance. And both of those theories together, which are, as I said, they're economic theories of decision-making and choice, remind us of the centrality of the therapeutic alliance in healthcare. They remind us to engage warmly and curiously with our patients and clients, to really take time to understand their needs, and only then to use our particular expertise, whether that's surgical or medical or psychological or dietary or whatever it might be, only then to use that expertise to be able to explore the options that are available, explain the options that are available, look at the possible adverse outcomes, discuss those, hear from the patient their own response or reaction to those possible adversities, and then allow the patient to make the decision that's right for them based on all of that. And if we follow that model, then we can be confident that we are literally empowering patients to make decisions about their own care. This is probably the the purest form of patient-centered care in many ways. We're putting the patient right at the heart of the decision-making. And we can equally be confident that we have executed our own professional duties in an exemplary fashion.
Well, let me say, Simon, one of the things I deeply admire about you is your therapeutic alliance. And so for that very reason, I think you should remain a psychologist as compared to migrating over to becoming an economist. So that's my takeaway from me. But no, it's true. I think that there's real value in understanding that decision regret, and how we mitigate that, and certainly that taking all things into consideration so that we can have confidence in the decisions we're making, and then realize that what comes from that, well, you know what, that is what it is.
Yeah, exactly. Yeah, and I don't regret not being an economist.
There you go. May all your decisions from henceforth be excellent ones.
Lift is presented by Simon Matthews and Darren Morton. It's sponsored by the Lift Project and supported by Avondale University. Music provided by Pixabay. If you have a question or a topic you would like to hear more about, send us an email to podcast@theliftproject.global. The Lift Project. Lift your mood, lift your life.